Hello, everyone. We're the biology group, and our project is focused on the many ways of helping others through healthcare. So, our mission statement is to address the physical, cognitive, and emotional healthcare needs of our community by providing excellent, compassionate, and accessible care while promoting the holistic well being of each individual by encouraging innovation, efficacious communication, and a lifelong journey of learning. So the theorist we focused on was Eric Erikson. Um, Erikson identifies 8 stages based on age ranges and identifies a specific psychological conflict that shapes identity and growth within that stage. So my research was focused on innovative problem solving in healthcare, specifically physical therapy. So a common issue in physical therapy is patients not completing exercises that are prescribed to them to perform at home on their own time as part of their plan of care. This is commonly attributed to issues of self-efficacy, poor social support, or a feeling of helplessness. So the article I read was focused on finding a creative solution to this problem, which was rather than prescribing traditional exercises, using game-based exercises such as virtual reality while being supervised on a virtual call, like on Zoom or something, with a physical therapy professional. And I thought this was a cool example of using an uncommon new age technique to solve an age old problem to better the lives and treatments of these patients.
Hello, my name is Eric Floyd, and my career path is physical therapist assistant who specializes in multiple sclerosis, physical therapy, and the importance of physical activity and exercise to help with symptoms of the disease and to help assist in living a better quality of life and overall within the healthcare industry, the importance of recognizing and emphasizing the patients that being physically active exercising is important as well. Wellness is a priority for people with multiple sclerosis and can be achieved through health behaviors, including physical activity and exercise. Healthcare providers should endorse and promote the benefits, safety, and exercise and lifestyle physical activity for every person with multiple sclerosis. International experts in the fields of MS, exercise, rehabilitation, and physical activity, physicians, nurses, physical and occupational therapists, exercise scientists convene that progress towards these goals should be gradual based on the person's abilities, preference, and safety. The physical therapist assistant approach is hands on by leading the treatment plan developed by the PT while observing the patient's ability to perform the interventions and reporting to the PT regarding the process.
Connecting behavior and the environment. Behavior adapts naturally over time, shaped by consequences in a way similar to evolution, allowing change to occur without relying on internal reasoning. This evidence based perspective supports learning and personal growth that is empowering, meaningful, and grounded in observable principles. Applying these ideas align closely with our group's mission of providing compassionate, accessible care that addresses physical, cognitive, and emotional needs while promoting holistic well being, fostering innovation, and encouraging a lifelong journey of learning.
Hello, my name is Isis. My major is animal science, and my presentation is how humans can help animals as vice versa. I think this is something very important as we know we as humans have pets as animals, we have them help each other when it's something very critical. For instance, animals can help diagnose sickness in children like diabetes, cancer, and Parkinson. They can also help the blind and people who can't mend for themselves. And as humans, I think it's very important that we also help them as they help us. For instance, pollution and offering aid. When we come to understand that taking care of them is also helping us with ourselves by using Eric Erickson's as the theorists, we can come to understand how important it is for where our animals are kept and where they are needed. For instance, the way that we can help them with resources and more understanding of what they can take care of. I'd like for us to consider a couple of things. For instance, how we can be more affordable in the way that we help them out. Instead of giving someone else a pet for a present, we can consider where they are in life right now, if they are able to afford the animal, if they are able to feed it as well. It's important to understand that everything that we help with these animals is to provide a better healthcare for them. It's important to understand that the pets don't live as long as we do, and it's important to also be able to provide them a safe haven when they do pass. It's important to know that anytime we have a pet, um, that we can provide them with the best health care, even when we are not financially well. For instance, we can go to clinics that offer free food, they offer free beds, and they offer free toys. They also offer many shots that are given. So if you have a family member that needs help, that can also be very helpful. From the research in my essay, I was able to see how children and animals have come to live with each other, learn and evolve their ways with each other. We know that humans depend on animals more than animals depend on us. However, the sickness that animals have is much harder and expensive to determine because there is no way for them to let us know what's wrong with them without many tests. The cost of these tests and medicine sadly are the reason why there aren't many mass productions and clinics that aren't available to have these resources. I hope that this sideshow can help you understand a better way for us as humans to do our part for animals as they do to us, because many times our pets are our own family.
Hi, my name is Gavin Klein, and I will be talking about research conducted on qualification, training, and integration programs for immigrants and refugees in healthcare. A large percentage of immigrants and refugees, especially in healthcare, are typically highly skilled and highly educated workers, and they have a lot of training and background in specific disciplines. Um, but they typically face many additional barriers, which make working in their host country incredibly difficult and frustrating and demotivating. Um, these can be language barriers, differences in standards and practices. And what this research found was that observational or teaching clinical practice and social support for these specific healthcare workers coming in from other countries. Programs as short as 2 days, extending all the way up to 2.5 years, had a very noticeable impact on immigrants' efficiency, confidence, and productivity in the workplace, as well as helping in like social aspects, feeling connected with their coworkers and forming relationships with their coworkers. And what this research found is that these are an essential tool in immigrating or integrating migrant workers into the differences of a host country's healthcare practices and systems.
I'm Mari. My major is nursing, and on this slide, I wanted to share with you what researchers found about how parents' behavior during play affects young children's language development. A team led by Rivera studied 90 little children aged about 15 to 31 months along with their parents. They used a special tool which watched how parents interact with kids during play and how this affects the child language development. Researchers show that the positive and warm parent child interaction, things like showing enthusiasm, making eye contact, giving encouragement, and responding to a child's action, help children learn more words and feel confident. And it's not just the amount of talking that matters, but the quality of the interactions. Children learn best when they feel emotionally supported and motivated to communicate. Children's language was measured with standard development tests, receptive tests, this means what child understands, and expressive tests, what child says. What the researchers found when mom and dads encourage their children, letting them explore, giving them freedom and play, these predicted about 18% of differences in the children's ability to understand language. When moms were responsive, reacting to what children do in teaching, these predicted about 16% of differences in children's ability to speak and use language. And researchers highlights that both parents matter. Different roles support different skills. Mothers' responsive and teaching behavior help children speak more words, while fathers' encouragement and teaching help children understand words. So, what does it mean? It shows that the children's language development depends not just on the time parents spend with them, but also on the environment around them. Simple actions like talking while playing, encouraging the child, naming object, and responding to their interests can make a big difference.
Okay, my name is Mark Lanson. I am a psych major at Sacramento State College, and my slide is the mental health and grace in healthcare. As a healthcare provider, it is also very important to understand and know that CPTSD and PTSD is an ongoing and widespread problem that contributes to one of the leading causes of death, specifically from suicide. From the article that I read, depending on how severe the abuse is in someone's childhood, it can be a strong association or link to greater chances of suicide. And so this is not just tied to one culture, as the study from the article that I read has proven studies and previous studies, I should say, happens worldwide, as in the case of the four countries. The study took place in the countries including the US, the UK, and China and Malaysia. And so the key findings from those four countries is that CPTSD, which stands for Complex Post Traumatic Stress Disorder, um, is a strong, significant predictor of suicidality. PTSD alone is not an it's not a significant association with suicidality, but the cultural consistency suggests that there's a shared biopsychological pathway rooted in early developmental trauma. And so, why see PTSD elevates suicide risk from a biological, psychological view is that it affects its effective dysregulation, which reflects heightened limbic reactivity or weakened prefrontal regulation. It has a negative self concept, which signals long term distributions in identity formation and self worth. And there's interpersonal disturbances emerge from attachment pattern alterations, shaping isolation and relational fear. And together, when you combine these factors, they map onto neural and behavioral vulnerabilities that feel hopelessness, impulsivity, and emotional pain, which are key drivers of suicidology. And so, learning how to help understand others and give them grace and empathy is potentially a huge step in curtailing the chances of someone taking their life. This is especially for those who have trouble creating and maintaining healthy and stable relationships, which is one of the common symptoms of abuse from childhood. The maltreatment, depending on the severity of the maltreatment in someone's childhood, which can be a is a huge factor in complex PTSD. And so, just to kind of give further information with the mental health and clinical implications, PTSD focused treatments may miss neurobehavioral impairments tied to emotional regulation and self concept reconstruction. And when it comes to complex PTSD, or CPTSD for short, it requires interventions emphasizing emotional regulation and distress tolerance, compassion based self rebuilding, and relational healing and attach informed care. So I'm going to go move on to the next slide. So, in conclusion, healthcare is a service that everyone will need to seek at some point in their life. typically during a time of despair. Considering this, how we interact with our patients, we should keep in mind that they should be treated with mindfulness, empathy, and respect. And so, going on to the next slide. So, for further considerations, we need to have an understanding of Erik Erikson's 8 stage of psychosocial development, which is important when interacting with patients and clients. There's different stages of psychosocial development present, which present different. Psychosocial crisis. So understanding what stage, age range they are in is helpful to know the best way to approach treatment. Basically, knowing the stage age range a patient is in their lifetime is especially contextual in knowing how to talk to them, how to approach them in a more, in a very nuanced way. Like, for example, if it's someone who's 3 to 5 years of age, um, or at least maybe 3 to at least 7, 8, any young child's age, you approach them with a lot of care and empathy, and you make sure the delivery is very soft, and you relate to them using childhood anecdotes, like your favorite cartoons or something like that. With adults, especially someone who's like college age, maybe like for another example, like someone who's between the years of 18 to like someone in their mid 30s, you relate to them about what their college life was like what your college life is like. You talk to them about courses that were tough, like what was beating you down, like you just kind of fall through with you're following your patients, and you're emphasizing, you're building rapport, and you're building essentially a professional patient client practitioner relationship, and everything you fall through, and you basically show empathy, you show kindness, but you also make sure there's professional boundaries as well, so that there will be less complications. But that's besides the point. These are the further considerations here. Going on to the next slide. So this is the bibliography. Um, this is all of our works cited sources. So we're not plagiarizing. None of my group members ever plagiarize. So feel free to read through. And then we're gonna go on to the next slide. After I'm gonna wait a couple seconds so that there's time for you guys to read through the cited sources. Okay. Next slide. And these are the rest of the sources, our references for our bibliography. So take a few minutes or a few seconds to read through the cited works. Feel free to pause as well if you need more time to read through it. We are the biosocial, or the bio, excuse me, we are the bio group in Psych 370. This is our presentation. I hope you guys enjoy what we were presenting when it comes to healthcare, you know, providing for healthcare, and have a nice day.